Last year, I treated a 67-year-old man whose arteries were so stiff. They felt like concrete. He was already on 4 blood pressure medications. 4. And his numbers were still dangerously high. He wasn't careless. He wasn't ignoring his health. He was doing everything he had been told. And yet, his body was still under attack. Here's the part that stayed with me. The solution wasn't missing. It was sitting in his kitchen the entire time. And one of the most dangerous mistakes he was making? It was happening every single night, without him even knowing it. In this video, I'm going to show you 5 simple changes that can support your blood pressure naturally, starting today. No new prescriptions. No expensive supplements. Just food, working the way your body actually understands it. I'm Dr. Robert Anderson, and after years of working with cardiovascular patients across the US, I've learned something most people are never told clearly. After the age of 60, high blood pressure is not just about salt or stress. Something deeper is happening inside your arteries. Think of your blood vessels like a flexible tube. When you're younger, they stretch easily. They absorb pressure. They adjust to changes in blood flow. But over time, something changes. They begin to stiffen. And when arteries lose flexibility, pressure builds up. That's when the risk starts rising quietly. Heart disease, stroke, cognitive decline. And what drives this process more than anything else? Chronic inflammation. Not the kind you feel. Not pain. Not swelling. This is low-grade, silent inflammation inside your blood vessels. Day after day, year after year, it slowly damages the inner lining of your arteries. This lining is called the endothelium. It controls how your blood vessels expand and relax. When it's inflamed, your arteries lose that ability. They stay tight. Your heart has to push harder. And your blood pressure rises. Now here's the key point most people miss. Every meal you eat either reduces that inflammation or makes it worse. There is no neutral. Let me ask you something. When you sit down to eat, what do you reach for first? Bread? Rice? Potatoes? Most people do. And that one habit may be raising your blood pressure more than you think. Here's the first change. Eat your vegetables first. Before anything else. It sounds simple, but the mechanism is powerful. Vegetables are rich in fiber. When you eat them first, that fiber forms a kind of barrier in your digestive system. It slows down how quickly sugar enters your bloodstream. And that matters because of insulin. Every time your blood sugar spikes quickly, your body releases insulin. And insulin does something most people don't realize. It causes your blood vessels to constrict. Tight vessels mean higher pressure. So by simply changing the order of your food, vegetables first, protein second, carbohydrates last, you reduce that spike. And in many patients, that alone leads to noticeable improvements within weeks. Now let's move to something most people already have at home, but don't use correctly. Apple cider vinegar. 1 to 2 tablespoons, diluted in water, before meals. Here's why it works. The active compound is acetic acid, and it does 2 important things. First, it improves insulin sensitivity. That means your body needs less insulin to manage blood sugar. Less insulin, less vessel constriction. Second, and this is critical, it helps stimulate nitric oxide production. Nitric oxide is what tells your blood vessels to relax. It's your body's natural pressure release system. When nitric oxide levels improve, arteries widen, blood flows more easily. Pressure drops naturally. But here's an important caution: never drink it straight. Always dilute it. And if you have acid reflux or stomach issues, talk to your doctor first. Now let me ask you something most people never think about. What is your blood pressure doing while you sleep? Because this is where things get serious. Blood pressure is supposed to drop at night. Your heart is supposed to rest. But for many people over 60, it doesn't, it stays high, or even spikes. This is called nocturnal hypertension. And it's one of the strongest predictors of stroke and heart attack. The dangerous part? You won't feel it. Your daytime readings can look normal, while damage is happening every night. So what can help? Walnuts. About a small handful, around 30 grams, before bed. Here's why. Walnuts are rich in alpha-linolenic acid, a type of omega-3 fatty acid. They also contain arginine and natural melatonin. Together, these compounds help relax blood vessels, reduce inflammation, support healthy nighttime blood pressure patterns. Think of it as a signal to your body: slow down, recover, repair. And for many patients, this simple habit leads to better morning readings and improved energy. Now here's something most people overlook completely. A simple drink. Hibiscus tea, 3 cups a day. It might sound basic, but the science is strong. Hibiscus contains compounds that act similarly to ACE inhibitors, a common class of blood pressure medications. It helps block the signals that cause your blood vessels to tighten, which means your arteries stay more relaxed. In clinical studies, regular consumption has been shown to reduce systolic blood pressure by several points. That's not small, that's meaningful. But again, balance matters. If you're already on medication, talk to your doctor before adding it regularly. Now I want you to go to your kitchen for a moment, mentally or physically. Open your cabinet. Look at your cooking oils, because what I'm about to say may be the most important part of this entire video. Most common cooking oils, like soybean, corn, and canola oil, are extremely high in omega-6 fatty acids. And in excess, omega-6 drives inflammation. Remember what we talked about earlier? Inflammation is what stiffens your arteries. And here's the problem: modern diets contain up to 20 times more omega-6 than omega-3. That imbalance fuels chronic inflammation. Even worse, these oils break down under heat. They oxidize and produce compounds that directly damage your blood vessels. You don't see it. You don't taste it. But it accumulates. So what should you use instead? Extra virgin olive oil for most cooking. And for higher heat, small amounts of real butter. These options are far more stable and support vascular health instead of damaging it. Now let's step back for a moment. You've just heard 5 simple changes. Eat vegetables first. Use apple cider vinegar. Have walnuts before bed. Drink hibiscus tea. Replace inflammatory oils. And I know what some of you are thinking.
This sounds too simple. If it really worked, I would have heard this before. I understand that reaction. But after years of working with real patients, I can tell you this: the body does not need complexity. It needs the right conditions. Every one of these strategies works through the same core mechanism: reducing inflammation and improving blood vessel flexibility. That's the foundation of healthy blood pressure. The patient I mentioned at the beginning, 6 months after making these changes, under medical supervision, his medications were reduced, his numbers stabilized, and for the first time in years, his body started responding again. So here's what I want you to do. Not everything, just one. Pick the easiest one for you tonight. Start there. Because real change doesn't come from doing everything at once. It comes from consistency. Your arteries are not fixed, they are responsive. And if your blood pressure is rising, that's not just a warning, it's an opportunity to act. Because what you do daily, quietly, in your own kitchen, can change everything.